All right, everyone, it is episode time once again, and we are here with repeat guest, Dr. Judson Brandeis, and he is kind of the cock expert. I'm going to say, just so you know.
Like cock-a-doodle-doo or like roosters?
No, not that. No, I'm talking about like the body part of a human.
Know you are. I'm just fucking with you.
Cock-a-doodle-doo. Maybe you haven't taken that role on, but that's what we have deemed you as, or I just did. So sorry about that.
So Dr. Cock, right?
Dr. Cock. It's Dr. Spock, but cock. Anyway, if you're not watching us on YouTube, you should go watch on YouTube because April's doing Spock moves, and so is Dr. Brandeis. And we will have clips on social media. But so he was on Dr. Judson Brandeis, episode 261 on sexual health and performance optimization for penis owners. And we're talking about a similar concept. And yet I understand that you have new studies that have come out that are actually kind of groundbreaking. And so we're really focusing on penis enhancement in general. I don't know what in general means, but we'll see what happens.
And I don't know what enhancement means.
I know.
I can only imagine.
Yeah. Or when I first read it, I was like, enlargement? And I was like, no, we're talking about enhancement. So, so before we dive into all of the enhancement and enlargement pieces, how did you get to where you are in the field of sexuality? Even though our listeners have heard your bio, you've been here before. Can you share a little more about your story?
Yeah, so I was a general urologist. So I got into urology as a kidney transplant surgeon. And then I decided I didn't want to keep waking up in the middle of the night and going to do transplants. And so I dove kind of into general urology. I helped pioneer surgical robotics with the Da Vinci surgical robot. I helped build kidney stone centers and MRI-guided prostate biopsies. And about 3 years ago, I became really interested in regenerative urology. So the ability to help men improve blood flow to their penis at an age or a time in their life when things were in decline. And so I helped do studies on shockwave therapy and platelet-rich plasma and stem cells and peptides and other regenerative technologies. And that's really what got me interested in sexual medicine.
Oh, wow. From the kidney to the
cock.
Other. Yes.
There you go.
I love it. Okay. I forgot about that when you were on the show last time. And your episode that aired, I don't know, maybe 2 years ago. I'm not sure exactly.
Only a year.
Maybe a year. But it was really enlightening. I loved just talking with you because you're full of such amazing information. You really are. And your book is like half weapon, half encyclopedia because it's thick and like it's got a lot of juicy, good information. The 21st century man. So, okay. Moving on though, penis enhancement. All right. What does it mean? Is it a thing? And what are the options for penis size enhancement? Are we talking about just the size or what are we talking about here?
Yeah, so I'm the first scientist, a clinical researcher ever to show that you can increase the length, girth, and function of a normal man's penis. And I presented that information at the International Society of Sexual Medicine a couple of weeks ago in Miami. And it's really been kind of an interesting journey because I really don't care that much how big guys' penises are. But I would see guys, in fact, I saw a patient today who had a fat transfer and it basically destroyed his intimate life for the rest of his life. Because he has
what is a fat transfer?
Yeah. So he had this in Beverly Hills about 15, 20 years ago. Isn't it strange? Like all the bad stuff seems to come from Beverly
Hills. Except for
there's some good things too.
Except for that one.
The Real Housewives of Beverly Hills.
Yeah, there you go. But guys want more girth for their penis. And so they would do liposuction. Take out the fat, spin it down, and then inject it under the skin, but above or outside of the erectile bodies. But if you feel it, it feels like squishy, like a squishy beanbag, and it looks like a big pig in a blanket. Yeah, I mean, it's too girthy because the thing is you can't enhance the head of the penis.
Are they still doing this, or is this like an old school thing?
There still are people doing it, unfortunately. The other thing is that people are now using fillers. So hyaluronic acid like Juvederm or the same fillers that people get put in their lips or their face, and they inject it into under the skin, into the cock. Well, right. And so if you look, I looked up the price on this. it costs anywhere between $5,000 and $15,000 for a series of injections over like a day or whatever. And it lasts for about a year or two. And then you get a lumpy, bumpy penis, right? So all those movie stars, you see that the fillers are kind of sagging down and their lips look all weird. Well, that's the same thing that's going to happen to your penis. And you paid $5,000 to $15,000 for the privilege of doing that.
Wait, is that what happens? They droop? I didn't know that. So
yeah,
like gravity takes over the fillers?
Yeah, gravity takes over the fillers.
Whoa.
Yeah. Some of it gets reabsorbed because a lot of the fillers are kind of natural. Like hyaluronic acid is, in a lot of our bones and joints and stuff like that. But
I use that topically. Is that bad? Is my face going to start doing that?
Go make it better.
Okay, good.
Yeah.
Sorry, I'm not going to interrupt you anymore because that's important.
Back in Beverly Hills, again, there was a Dr. Rosenstein, I think his name was, who was doing suspensory ligament ligation. So the suspensory ligament hangs from the pubic bone, which is the bone that sits under the pubic hair and holds the penis up. And that's the reason when you get an erection that the erection goes up. And so if you cut the suspensory ligament, then the penis hangs lower. So it looks in the locker room like it's longer. But the problem is it doesn't change the length of the penis. It just changes the angle on erection and that it hangs lower. And then over time, these guys were getting scar tissue. And so then their penis wouldn't extend during erection. So in the end, they actually got shorter penises.
Interesting.
And now there's even from Beverly Hills, a silicone penile implant just for size. And I've seen myself at least 3 or 4 patients who've had them removed. There was just a paper at the meeting that I went to, 15 patients getting them removed. I think it's a ticking time bomb, and it's expensive. It's a $15,000-$20,000 surgery. So, here I was like, I think we can do better. I think there's actually a way to improve the length and girth and function of a normal, healthy man's penis. So we're not talking about a guy with erectile dysfunction. We're talking about like a guy between 20 and 50. And if you ask these guys, more than 50% of them will say that they want a bigger penis, than the other 50% are lying. Mm-hmm. Right? It's just one of these things that guys want. And I just wanted to prevent guys from doing something that could harm themselves.
So all dudes want a bigger penis? Really?
I think most of them do.
What about like the ones with the like John Holmes size cocks?
They're probably not going to Dr. Brandeis.
Yeah.
Okay, got it. Okay.
Yeah.
Although there is the top heavy issue where you have so much cock that it can't actually get fully hard to the point of having the form of penetration that you would see in mainstream porn. So there is such thing as I'm not doing air quotes too big. So I've seen that. I've seen it in person, not from people I've had sex with, but I've seen it in porn or sex education demos.
Just meat gazing.
Do you remember the story about my mom?
Yes. Oh, yes. Okay.
Yeah, my mom. So, so your mom, and anyways, so that does exist, and I want to just emphasize that as we talk about this penis enhancement piece, that we at Shameless Sex, and I don't know what your stance is, but we're not here to just say that large, thick cocks are the way. We love average cocks. We love cocks that are smaller, that know what to do with our bodies when they learn about our bodies. And that to us really ultimately is what it comes down to. And I think the enhancement piece is, and that's why we're not talking about enlargement. But we are talking about that a little bit. We're talking about performance, that we're talking about one's ability to have control over their cock, right? Is that what we're speaking to mostly? Yeah.
Well, the thing is, I totally agree with you. If you're comfortable with your size, fantastic. And I have no desire to shame anyone or pressure anyone or any of that stuff. This is entirely for men that voluntarily want to improve the length and girth and function of the penis. And it's a way to do it that's totally safe. So none of the patients in my study had any side effects, no infections, nothing had to be removed. There's nothing synthetic.
No lumpy things on the side?
No lumpy things on the side. And the growth of the penis is symmetrical. So you don't get a pencil penis from traction. You don't get a pig in a blanket penis from too much filler.
Oh my God, we have a good friend that not big, but she calls it a baby bird, a baby bird. But that's just a soft penis that's kind of like hiding inside.
It sounds like we're building cars. It's like it's built for speed. It's built for the track. It's built for longevity. It sounds like that, right?
We're on the racetrack.
Yeah.
So we're exactly on the same page. There's no shame in penis whatever size. But the interesting thing is, if you look at the studies of men that have penis enhancement for whatever reason, their penises are not the small ones. They're average size or sometimes even above average size. So, it just kind of is what it is. And the whole idea of this is, if you want to go down that path, there's a safe and effective way that actually also improves the vascularity, improves the performance of the penis.
Okay, so you said that in your clinical research that you had a lot of positive results. So what are the dangers to penis enhancement? And if you have, I love statistics, I know Amy does as well. Do you have any statistics for these positive results and how many folks that you investigated on R&D?
So my pilot study was 16 men. We're going to have, I think, 30 by the time we're finished. I'm going through the data now, but the average man in my study increased penile length by 0.85 inches, or about 2 centimeters, and increased girth about 0.47 inches, or about 1 centimeter.
Damn. All right.
Okay, well, what are the dangers? What are the dangers, though? Because there has to be some sort of disclaimer, right? You have to sign something, I'm sure, before you go.
You might die. You might.
So this was we wrote our clinical research protocol. We got institutional review board approval. We actually had it listed at clinicaltrials.gov, which is the NIH website. In fact, we had this one guy call in from Ohio, right? And he's like, I want to sign up for your study. And I'm like, that's great, sir, but you're in Ohio. He's like, well, won't the NIH fly me from Ohio to California to participate in the trial?
That's dedication. Damn.
Are you familiar with the government at all?
I was like, sir, the NIH cares about curing cancer. They don't really care about growing penises. So, but, I did have guys flying from New York, from Florida, from Vegas, from Arizona, from Washington State. So, this is something that guys care about, and it's something that they're motivated to do. And if there's a way to do it that's safe and effective, they'll do it. And so the P-Long protocol, the P-Long study, involved the use of platelet-rich plasma. So injection of platelets or activated platelets into the penis once a month for 6 months. And then the use of a traction device developed by the Mayo Clinic called the RestoreX device, which it has been shown to be better than other traction devices because of the way it kind of grabs the penis and stretches it.
And no pun intended.
Yeah, there you go.
Whose plasma? Are you using your own plasma, or is it from a donor? Okay,
no, use your own.
Okay.
Yeah, exactly. That's why it's so safe, is you draw the blood, you spin the blood, 15 minutes later, you put the platelets back.
Interesting.
So it's not anyone else's blood. It's not stem cells. It's not, it's just high density PRP. Now you have to be getting the PRP from a high density kit. So there's different ways to get PRP, but we used a double spin system, and we draw 60 cc. So you need about 1 billion to 1.5 billion platelets per injection. And then we use the Dr. Joel Kaplan penis pump, because it's a hand pump, so we can measure the pressures. And then we used, I have a nitric oxide boosting supplement called Affirm from Affirm Science. And if you take 2 of those in the morning, 2 of those in the evening, it dramatically boosts circulation, so you get better stretching of the penis at night.
I think we know Dr. Joel Kaplan because he's at shows.
Yeah.
With the dog. He has a little dog.
Yeah.
And he's like such a wild character.
Yeah. I remember going to the booth. So I was like, oh, there's so many cock pumps around here. It's like a bunch of plastic cock pumps. Okay. Multiple questions. Is this the same as the P shot, or is the O shot, P shot? Are these the same thing?
So the O shot and the P shot are a technique of injecting PRP into the penis and into the clitoris. And it was developed by Dr. Runnels, who's down in Alabama, who's a primary care doctor. And for example, the P-shot technology uses 2 injections in each side of the penis and 1 in the head of the penis. But as a urologist, I know that the inner chambers, the erectile bodies of the penis, are connected. So there's really no reason to do 2 injections on either side because it's like putting 2 doors into one room. You only need 1 door. And then the head of the penis really doesn't have an erectile body. It's not connected to the erectile body. And it actually hurts like hell to get your penis injected in the head of the penis.
I mean, I imagine in my clit, it's the same tissue, right? So
yeah,
like,
exactly. And so, if you want to inject for sensitivity, like I've done that on a number of guys who either are diabetic or have had trauma down there, you want to inject in the frenulum, which is where most of the nerves kind of travel to. And so that's my rationale behind 2 injections was that that's all you need. And the other thing is I developed an ultrasound-guided technique. So a lot of people that are injecting PRP into the penis aren't necessarily sort of hitting the target.
Okay.
They think that they are.
Yeah.
But once I started using ultrasound every single time I was doing injections, and there are very few people that have put needles in more penises than I have. That's
claim to fame.
Claim to fame, right? There's my 15 minutes in the sun. Even someone really experienced like myself, who's an accomplished surgeon, you typically what you'll do is you'll go kind of through and through the corpora because you can't see where you kind of know where it starts, but you don't know where it ends. And so the P-Long providers that are part of the P-Long network are all going to be trained on using ultrasound to guide the needle to make it much more of an accurate scientific process.
Okay. So it's almost you map the cock on some level and then kind of go in from there. So I just want to repeat something back to you because I want to make sure I'm understanding this. So this isn't just for the visual of having a bigger or longer cock. There's also this can improve, I'm assuming, some of the nerves that experience and the sensation. If you're a cock owner, these processes, the P-Long, the P-Long, and you're going to have to go over the PRP thing as well with me because
so maybe I can explain what PRP is.
Please, that would be great.
So the platelet is a really interesting cell, right? There's only one kind of platelet in the body, right? So platelets go all over your body. And platelets have 2 functions. One function everyone knows, which is to cause a clot, right? To stop bleeding. So say you're cut yourself, right? And then the part of your body that's cut or injured or traumatized calls out to platelets to come and create a clot. And they call out by releasing calcium and a bunch of other cytokines and factors that make the platelets home to the site of injury, right? And platelets are round. That's why they're called platelets, right? But when they're activated by calcium, they put out little arms. They almost look like starfish, and they grab onto other platelets and they form a web that then red blood cells and clotting factors get caught into that causes like a big wad of tissue that creates a clot, right? And we all see that happening all the time. But the other thing that they do, which is totally ingenious, right? The big guy in the sky really know, or him or her knew what they were doing.
Or they, them.
They, them, right? Is they release growth factors, right? So at the same time you're starting the clotting cascade, you're also starting the rehealing cascade. And so, if you cut your finger, none of the other skin on your arm grows except for that little area of your finger that grows back really quickly.
Interesting.
And so that's the genius of platelets. And that was discovered, 20, 25 years ago. And so professional athletes use that for knees and hips and shoulders to help improve healing. We use it for hair growth. We use it for wound healing. And then now it's used for sexual rejuvenation, either with the O shot or the P shot. And I just took advantage of that idea and then made sure that I used a very high quality PRP machine with 1 billion and a half platelets, and then added that, right? Because when you have growth factor, you have growth, but if you don't give a growth a directionality, then it's just growth, right? So I had a friend who's an orthodontist, and he was telling me about a patient of his that had twins, and he put braces on this patient. He said he's never seen teeth move as quickly because that woman had so much growth factor floating through her body that the teeth moved really quickly, right?
Because she was pregnant. She was pregnant.
Because she was pregnant.
She had major growth hormones going on in her body because she has.
Exactly.
Interesting.
Exactly. Right? Because when you're moving teeth, you're breaking down the teeth in front and remaking the teeth in the back or the tissue. And so that's what you need, is you need growth factor, but you also need that pulling that you get from braces. And so in the P-long protocol, we have massive amounts of growth factor from the platelets, but then we also have traction. We also have suction for circumferential growth, right? Because if you look at the penis under the microscope, not that penises are small enough that you need to use the microscope, but
we got you.
We get what you're saying.
The cells.
There you go. You look at the cells, right? There's 2 layers of collagen because the penis increases in length and it increases in girth. So there's 2 separate sort of belts of collagen. And so you want to make sure that you increase both the length and the girth. And so the way to do that is growth factor, and then also with a circulation boosting supplement, because as we know, we're supposed to be getting 30 to 60 minutes of erections every night when we go to sleep. And so let's take advantage of that by boosting nitric oxide, which boosts circulation, which is sort of nature's Viagra.
Okay.
Nature's Viagra.
So
Sounds sexy.
that did explain the PRP. Okay, so you mentioned stem cells a little bit, and I don't know. So this is another regenerative treatment. I don't know if it's accepted by the FDA or whatever people now that have to in this country, in the United States, where we're doing this interview. I know that stem cells, there's a lot of research, and I don't know if it's still an acceptable protocol for regenerative treatments. Can you talk about stem cells a little bit? Because I'm curious.
Yeah, so I can explain to you what stem cells are. It takes about 3 or 4 minutes,
Please.
but your audience really will begin to understand what they are. Okay, and stem cells are not allowed to be used in the United States outside of a research protocol. So if you go to someone and they're giving you stem cells and they're in the United States, they're not doing what they're supposed to be doing. And the reason for that is that, in the United States, people just kind of market something and say it works and then charge people for it. And that, to me, as a clinical researcher, that's really difficult to accept. And that's the reason why I did the P-long study, is because I wanted to prove that it worked. Because if it didn't work, I wouldn't be here talking to you about it right now. And also, I want to create reasonable expectations for men who are going into this, right? So if you're going into it thinking, I'm going to grow 6 inches in 6 months, this is the wrong thing for you. If you keep to the protocol, you can expect about 1 inch of length, about 1/2 inch in girth, and improvement in function, kind of subjective, right? Because all of our patients by definition had normal function, but as a guy, you can tell when things are working better, even when they work pretty well beforehand. Okay, but you asked me about stem cells.
Yes.
Okay, all right. So sperm meets the egg, right? 23 chromosomes on either side. Now you get one single cell with 46 chromosomes, right? That's what we call the totipotential stem cell, right? From that one cell, in 9 months, you get a baby, with all the organs formed and everything like that. So then that cell starts to divide, 2, 4, 8, 16, 32, 64, so on and so forth. And then it forms what's called a blastula and a morula, which have 3 layers, okay? So one layer is the ectoderm. Ecto means outside, like skin. One layer is the mesoderm. Meso means middle, right? So muscle, blood vessels, heart, liver. And then the other layer is the endoderm, or the inner layer. So that's mouth, esophagus, intestines, pancreas, so on and so forth, right? And so as the fetus begins to keep growing, those 3 layers become more differentiated, right? So then you have basically 3 lines of stem cells, the endo, the ecto, and the meso. So if you wanted to grow skin, you want to use the mesenchymal layer. You'd want to use the ecto layer. If you wanted to grow intestine, you would want to use the endo layer. And for growing blood vessels, you want to use the meso layer, the mesenchymal layer. So when you hear about stem cells being used, most of the time it's mesenchymal stem cells. Okay. Now, where can you get stem cells? You can get them from fat. Okay. So you get liposuction, you spin the fat down, right? Because a lot of us have extra fat and it's easy to get to. You spin it down and you get stem cells from fat. So most of our tissues have stem cells. And the advantage of stem cells from fat is that they don't reproduce that much. But, my fat stem cells are going to be 55 years old, right? So you're not getting stem cells from a newborn, but you're getting them from yourself, but you're getting them from a tissue that doesn't repeatedly reproduce or split, right? Another place you can get stem cells are bone marrow, right? So you can stick a needle into the iliac crest, into the hip, suck out some bone marrow. Now that also is mesenchymal, but that's making red blood cells, white blood cells, and platelets. That's a very rapidly dividing type of stem cell, but it's also 55 years old, and it's divided a lot more than, say, a stem cell from fat. Okay? And then the third type of stem cell is from birth waste.
Like the placenta, that is the off,
so
right?
we
waste. Can we just take a moment to not call it birth waste? Sorry,
Sure.
I'm sorry. I've never given birth, but I'm just like, oh God,
okay,
Jesus Christ.
Well, okay, but the reason I use that term is that it's not just the placenta.
Okay.
So it's Wharton's jelly, it's amniotic fluid, it's
the leftovers that help preserve a child and for 9 whole months. I'm not a mom, but yeah. Anyways.
Yeah. Okay. I'll find another.
You're working that, Dr. Brandeis.
Yeah. I'm sorry if I offended anyone.
I'm not offended. I'm not
I
a mom.
It. I think it makes sense. It's the birth stuff that
I don't like it one bit.
Yeah. But it's more than the placenta. It's the Wharton's jelly. It's the amnio. So you can get because the baby goes from one cell to, a fully formed 7-pound baby in 9 months. There's a massive amount of growth factors. And so you can take those afterbirth products.
Nice correction.
and process them and isolate the mesenchymal stem cells. And you can also get what are called exosomes, right? So now the advantage of afterbirth products are that they're from a freshly born baby, so that they're like brand new stem cells, and they're rapidly growing. The downside is that they're from someone else, right?
And no babies are harmed. It's just the afterbirth stuff.
Harmed.
Yeah. Right.
Yeah,
it's not like QAnon people that I don't know.
Sorry, QAnon.
Yeah, sorry. Or not sorry. Okay, cool. So that's what people take, but it's not
that's option 3.
So they sign the moms up, and then they check them for every disease known to man, like before, during, after. But still, there are diseases and viruses that are out there that we don't know about that maybe these people have that might cause you cancer and X number of you, who knows, right? Yeah. But that's another option for getting stem cells. And then in the amniotic fluid, there are what are called exosomes. So that's the other thing to understand is, how do these stem cells actually work? So the way I explain it is like a general contractor, right? So if you're a stem cell, there are 2 ways that you can cause the growth of tissue. One is you can replicate yourself and make yourself into other tissue. So that's like a general contractor that comes to your house and does like the electrical, the plumbing, the drywalling, the painting, all that kind of stuff themselves. The other thing that you could do is, like, if you're a general contractor, you can get on speed dial and you can call your electrician, you can call your plumber, you can call your painter. And so a lot of stem cells, basically what they do is they produce messages. They put them in these little vesicles and send them out. And those are called exosomes, right? And so like an exosome might have vascular growth factor that tells the tissue start growing blood vessels, or, an exosome might have nerve growth tissue that tells the tissue to start growing nerves, right? And so most of the stem cells, as it turns out, work through what's called a paracrine system, which is just sending out exosomes that tells the tissue to grow. And so when you get those placental or afterbirth product growth factors or stem cells, that's how they're working. So they don't actually stick around for more than a week or so, and then they die out.
And so you're saying the stem cell piece, just like the PRP, is this injected into a cock?
Yeah. So with most stem cells, it's actually injected into the location. So it's injected into the knee or the shoulder or the penis or the clitoris. Although there are stem cell clinics that also do intravenous injections of stem cells. And, very few of these products have legitimate studies, where they take 100 people that, they inject salt water, and 100 people they inject stem cells, and they show an improvement.
Is it so? And that's illegal, you said, in the U.S. to get stem cell injections at this point, or
outside of a clinical trial.
Okay,
outside of it. Okay, got it.
So within what you're doing, the P-Long trials or not P-Long protocol, that is something that is actually within legalities in the U.S.
Right. Well, PRP is different, right? Because PRP is just taking out your blood, spinning it down, isolating your platelets, and then re-injecting it back into you.
Okay. So the other version is so you're taking it from elsewhere.
Right. So, if I wanted to inject my platelets into someone else, that would be a whole different ball of wax.
April, do you want my platelets?
No, but I'm thinking if you had a child, you could kind of like preserve the afterbirthing product
in the freezer. Isn't that a thing?
I think that they like ground up
blood.
Right.
They do cord blood. Registries.
I'm wondering if that would be something that you could do if you get a knee injury, you had a kid, and then 18 years later, and you froze all of the embryonic fluids and some of the afterbirth materials that come out, and then you had that injected. If that would be something that would be effective for helping you heal. I wish I had a baby now. Damn it.
Yeah, I mean, there are legitimate doctors that are growing biologic tissues now. There's a guy, Tony Atala at Wake Forest, and he grows. There's a condition, I forget what the name of it is, what little girls don't grow vaginas properly. And he actually 3D prints the matrix for vaginal tissue and then puts stem cells into that matrix and grows real vaginal tissue that then they can use in surgery.
Interesting.
It's just mind-boggling. So, we never did cord blood for our kids. I think we were too cheap, but knowing what I know now, it actually would be, if my kid blows out a knee in 10 years, they'll be able to take that cord blood, isolate those stem cells, grow them up, with growth factor and create new biological tissues. I'm almost certain that that's going to be a reality.
That's awesome. We're so far from where we've been. And as someone who has a lot of questions about the medical world, I also have a genetic disease, which I won't share about right now because it's not about that. But I've come to grow a lot of love for pharmaceutical world, which I have also a lot of questions about, and the medical world, which I also have a lot of hesitation about. And I just am so grateful to live now where I have access to the medications that I need for my very rare genetic disease. And now we're hearing about access to other ways to up our enhancement for other reasons. And we're just so far along. And so what a wonderful age. And also, I know it's challenging for a lot of people. So I'm going to flip the switch a little bit. Testosterone time. Woo! We love testosterone. Okay. So what are some of the key points that penis owners should know about testosterone and how it affects the body? Yeah.
So testosterone is the main hormone for men. It's what makes us men. It's what makes us, boys in utero. So we're all born like with both. Yeah. Pops. I mean, when we're in that morula stage, we have both the male and the female parts, and then you produce testosterone and you produce Mullerian inhibiting hormone, and that makes you go in the direction of men. And there actually are lady parts that are still in us as men. So you have what's called the appendix testis and the appendix epididymis, which are the leftover parts of the female parts, which, as a urologic surgeon, you see sometimes.
Interesting.
Right? Yeah, that's a good Jeopardy question.
I like that.
Well, I don't know if I get it right. I have to rewind this episode.
All I heard was epididymis.
Alex, I'll take female parts for $500.
Yeah.
What is the vulva, right. Not a Volvo?
So as a boy, you're 12 years old, your testosterone's 200, you're kind of a scrawny little kid. And then by 18, your testosterone's gone from 200 when you were 12 to 1,000 when you're 18. and you've grown 1.5 feet, you've grown muscles, your penis has gotten longer, you've grown pubic hair, your voice gets lower, et cetera, et cetera, et cetera. You start chasing after girls or boys or
People,
or whatever you want, people that you want to chase after. And so that's the sort of the miracle of testosterone, is in a short period of time, that's what it can do. But then when you hit 20, every year or so after that, you'll drop a level of testosterone about 1 or 2% on average, right?
Every year. Wow.
Every year. So, women are different, right? So women go through menopause, 50 something years old, and their estrogen and progesterone will just plummet and they go into menopause. Whereas men, go through what we call andropause, which is
menopause,
or menopause, right? And you just go through this slow decline. Okay. And what does that slow decline result in? Well, it makes it more difficult to build muscle. It makes it more likely that you're going to put on fat. Your libido goes down. It's more difficult to sleep. You got aches and pains. You lose hair on your head. You get more grumpy. It affects your motivation, your drive. All the good things about sort of being youthful and young, you lose when you lose testosterone.
And you talked about vulva owners and their testosterone, as well as the estrogen and progesterone, the different hormones, which more commonly spoken about. And is that something in terms of testosterone? If I'm a vulva owning cis woman and I'm 40, and so I know that when I've had my hormones regulated, I know that testosterone is important for driving my sex, driving my libido,
that pussy,
making that pussy, and I want to make sure I have the normal, and I hate that word, that's why I was trying to avoid it, but the normal amount, the healthy amount of testosterone, right, in my system. Anything else that I should know as a vulva owner?
Yeah,
since I have you?
It's important to know that men have testosterone and estrogen, and women have testosterone, estrogen, and progesterone, right? And it's just a different level and different ratio. And we're all taught men are from Mars and women are from Venus. But if you look actually at the molecular structure of testosterone and estrogen, the only difference is a single hydrogen atom, right? So the smallest unit of matter is the difference between testosterone and estrogen. So it's very easy for your body to convert testosterone into estrogen.
I'm from Uranus.
Oh, sorry. Wait. No, I know you're just from Uranus, but I still want to know about converting testosterone.
I just had to make him laugh.
I want to know what he's talking about. Damn it, Chip. I'm from Venus Vagina. Hey, that's a Burning Man name. Just
okay, so I totally fucking interrupted Dr. Brandeis.
So we're converting testosterone.
Testosterone and estrogen. So that, that's why women and the adrenal gland, so the ovaries make estrogen and the testicles make testosterone, but the adrenal glands kind of make a little bit of both, right? And then in men, testosterone gets converted into estrogen. And so especially men that are obese, fat is a great place to convert testosterone to estrogen, which is why fat guys get man boobs.
Oh,
because their estrogen levels are
lower
higher.
sex drive too. Would that
And
go
lower
hand in
sex
hand? Oh, interesting.
Yeah.
So the more weight you put on outside of your ideal, I'm doing air quotes, body, what's the index?
BMI, body mass, yes.
Yeah, would potentially lower your sex drive. And
absolutely.
Yeah.
And the other thing is, I think of things in sort of an evolutionary sense. So if you're a hunter and you're out on the plains, killing buffalo, you need really high levels of testosterone, right? Because buffaloes don't like being killed. And if you're a farmer and you're working the fields all day, you're not killing buffalo, but you're working really hard, so you need pretty high levels of testosterone. If you're sitting in front of a computer all day, or especially if you have a laptop sitting on your lap producing, warmer temperatures, your body is smart. Your body says, listen, I'm not tilling the fields and I'm not killing animals, so I don't need to make that much testosterone. So that's why the level of testosterone as measured in men in the United States is declining each year. And it's like 30% lower than it was 50 years ago, because we don't do the things that generate the need for more testosterone. We're not as physically active.
That's so interesting.
That is really, I know that just blew my mind.
And it makes perfect sense. And
I feel like I'm a 12-year-old fucking boy half the time, or like a frat boy.
But she's on her laptop a lot.
Yeah, so I gotta get out. I can't kill a wild animal because I don't want to, but I need to get out. And what do I need to go to the gym and like slap some ass or something consensually?
Yeah, pretty much.
Okay.
But I like the idea also of the reminder that when your body changes, it's your body's wisdom changing potentially. So you actually are someone who comes from Western medicine. You're actually speaking from kind of a holistic approach from my vantage point, where when you're saying that your body is actually really brilliant and it's listening to your outside circumstances, it's responding and then shifting, which wouldn't generally be how traditional Western medicine would approach sexuality, at least from what I'm used to, right?
I totally agree with you. I mean, the way that I approach sexuality is, most of my patients are men over 40, 45, 50. And so to me, there's like a Maslow's pyramid of midlife for men, right? And at the bottom is sort of physical health. So if you don't have physical health, you don't really have much beyond that. But if you have physical health, then you can focus more on mental health and emotional health and spiritual health. And the relationship health, very, very important, obviously. And then if you get all of those things right, then there's sexual health up at the top, right? And if you don't get the bottom of the pyramid right, then it's really hard, once you get past the age of 50 to have a really good sex life or really good sex health.
It's like the star on top of the Christmas tree or the Hanukkah bush.
Yeah, there you go. The icing on the cake.
I feel like it should be more of a foundation, though, sexual health, because it all is a quilt of things that are related. It's a web, if you will. And it's so important. I love talking to you every time you're on the show. It's so insightful because you're just full of information and you have a lot of technical, obviously medical words that I know because I love learning and the research and looking at the statistics. But I think that I just feel smarter and like I have more testosterone running through my veins.
Thank you for the testosterone,
Every
Dr.
time
Brandeis.
I talk to you. Yeah.
We just got a P-long shot. Just
Yeah.
Just not a shot, right? The P-long protocol.
P-long
Sorry.
protocol.
We got the
Yes.
P-long protocol. We
Not
just
a
got it. Yeah.
Well, if folks want to, if they want to work with you, Dr. Brandeis, also finding your book, The 21st Century Man, and any other work that you want to share, how can folks find you, work with you, buy your book? Please share it because you have so much to offer.
Awesome. So, we're developing an international panel of P-long providers that have all been trained by me so that, because not everyone can fly to Northern California. And so if you just go to p-long.com, you can find a certified P-long provider that's close to you. And you can also purchase the equipment that you need for doing the P-long protocol and all that kind of stuff. So go, and then there's tons of videos and it explains everything soup to nuts. So go to p-long.com. If you're interested in my book, just go to the 21stcenturyman.com, all written out in letters. And if you're interested in my medical practice, go to BrandeisMD.com, BrandeisMD.com. If you're interested in supplements, my men's health supplements, go to Affirm Science, AFFIRM Science.com. And then I have a really good YouTube channel, which is BrandeisMD, where I do a lot of teaching for physicians and lecturing to patients. And so I put up most of that kind of stuff on my YouTube channel. And then I actually even have an Instagram.
You'll be tagged in it because
it's really a good Instagram channel, but I don't put stuff up on.
Now you do because we're gonna have multiple clips. So.
Well, I mean, I have people that put stuff up on there. Like I'm not.
Yeah,
I'm actually reasonably technical savvy, but I'm not social media techniques.
Well, we'll have all these in the show notes too, by the way, and maybe not all of them, but most of them, because there are a lot of really extensive links. But we'll try our best to get most of them on there, so you don't have to remember all of them. Everyone, you can go look at the show notes wherever you're listening to this podcast. This should be on there, so you can find where to find Dr. Brandeis and his work, and how to enhance your cock.
Yeah.
Sorry, I just like saying
you
it
are 50.
Well, I like how some people just say penis. Like we have a friend. Yeah, here we go.
One of my fingers.
Live long and prosper.
Yes, live long, prosper.
We have a friend. Every time she talks about sex, she's like highly sexually active. She always says penis. I'm like, penis.
I call it
so
a peen.
weird.
I call it a peen.
A peen is like when I'm talking about my dog. A cock or a diaka is what I'm talking about, like someone I'm fucking. Anyways, tangent. So, okay, we found out how to work with you, how to find you. To all of our listeners, April's usually the closer. I'm going to close right now. If you have not reviewed us or rated us on iTunes or Spotify, please go there and do so now because it helps us grow, get the message out globally to people who do not have access to sex positive sex education, and especially messages from females, from people, females, people like Dr. Brandeis and others.
From the birth waste? It's from the birth waste.
No, it's from the
Just gotta
byproduct.
Yes.
He's
the
learning.
Afterbirth product.
Yes, I like it. See, we're all learning together. And also, if you really want to support us, also support our sponsors. We choose them very, very carefully. We actually say no to like what, 90% of the people that come to us.
Yes,
so
we do.
Yeah. So go and buy their products because they're really wonderful. And I'm going to let April close with this part because she has a better voice than I do. But what would you say at the end of the show?
I always want to give a shout out to each and every human that's listening. And thank you. We love you so much. We appreciate you. I say that from the bottom of my heart and I mean it. And I just love you. So I know Amy does too, because we talk about we have the best listeners ever. So thank you. Thank you for being part of the Shameless Sex revolution and making us part of your day or night, whenever you're fucking listening and wherever you are. And that's it. That's all. We'll see you next Tuesday for another episode of Shameless Sex, y'all. Ciao for now.